Thank you for your kind introduction. I'm Takuya Shimomura from from Tokyo Denki University. Uh, I I would like to start my presentation. A study of signal response investigation of skin deformation and sEMG on the biceps brachii muscle during isometric elbow flexion. The content of the presentation as shown this slide. Rehabilitation is important for the recovery of motor function in stroke patients. Assessment of the patient's motor function is essential. An effective rehabilitation method must be chosen from among various methods. The brainstorm stage is a common existing indexes for assessing motor function in stroke patients. The brainstorm stage rates on a scale of 1 to 6 for severity of hemiplegia based on the movement patterns. Patients with severe upper limb impairments fall into recovery stage 1 or 2. Patients with severe impairments have difficulty in voluntary joint movement. Therefore, existing indexes that assess from specific movements are not sensitive enough to assess changes in motor function. Movement in patients with severe impairment is similar to isometric movement. Isometric movement does not change joint angle, but does change muscle contraction. The patient is unable to perform voluntary joint movements, but muscle activity may be altered. Therefore, we consider it appropriate to evaluate the motor function of patients with severe upper limb impairment, not from the movements, but from muscle activity during movements. So surface electrogram sEMG is commonly used to measure muscle activity. The amplitude of sEMG varies according to muscle force, making it a suitable signal for evaluating muscle activity. On the other hand, according to previous survey, as shown in the figure below, it is known that muscle force and sEMG output have an exponential relation depending on the target muscle. Patient requires an evaluation method that is highly sensitive to low muscle sensitive. Patient requires an evaluation method that is highly sensitive to low muscle contraction. Muscle activity is measured not only by electrical signals, but also by mechanical deformation of the body. According to previous survey, measurement of upper arm strain during isometric movement confirm a linear correlation between upper arm strain and elbow joint torque. Therefore, we hypothesize that the use of mechanical deformation of the body would be effective in measuring low muscle force. The research purpose is to confirm usefulness of mechanical deformation of the body to measure muscle contraction at low muscle force. In the present study, we investigate the response of the signal to flexion force by measuring sEMG of the biceps brachii muscle and skin deformation and sEMG caused by muscle activity in isometric flexion movement of the elbow joint. A measurement environment is shown. The experiment was conducted on 5 able-bodied adult males. The sEMG and integrated EMG, IEMG, were also measured using a surface EMG measuring device. The force sensor was positioned so that the wrist was in contact with the side and fixed to the elevating table. A signal from the distance sensor unit sEMG, and IEMG were measured with an AD converter with a sampling frequency of 1000 Hz. This this figure shows the skin deformation and sEMG measurement device. The measurement target was the biceps brachii muscles. To measure the activity of the biceps brachii muscle, a distance sensor unit was placed on the elbow side and electrodes on the shoulder side. The distance between the electrode and the distance sensor unit was 20 millimeters. The electrodes were positioned so that they intersected the position of the maximum bulge of the biceps brachii muscle when the elbow was flexed. The figure shows the structure of the distance sensor unit. The distance sensor unit consists of a distance sensor, a plastic sheet, and a base and cover plate made of PLA. The distance sensor acquires the distance by receiving the irradiated light of the IRAD reflected by the cover plate with a photon transistor. A reflective sheet is attached to the cover plate to facilitate light reception by the photon transistor. This slide shows the relation between displacement and output of the distance sensor and the actual output. The distance sensor was adjusted so that the ratio between distance and output voltage was proportional. Measurement condition is shown. A skin deformation and sEMG of the biceps brachii muscle was obtained for isometric elbow flexion. The experimental movement consists of exerting force in the minus Z axis of the force sensor for 2 seconds and then relaxing for 2 seconds. The movement condition was defined as maximum voluntary force (MVF), which is the force spent with the maximum force the minus Z axis of the force sensor. And 8 conditions were set: MVF 80%, 60%, 40%, 20%, 15%, 10%, and 5% MVF. The subject was kept in a resting state for 5 seconds, and then they performed the 5 sets of movements. After the completion of the movements, the subject was kept in a resting state again until the end of the measurement time. This slide about analysis. Skin deformation and IEMG were used analysis. The VR was defined as the average of the measurement during the 5 seconds before the start of the movement. The maximum value of skin deformation and IEMG for each movement interval was obtained and designated as VM. The middle 3 times out of 5 sets were used for the analysis in order to analyze the data from the stable movement interval. VMR was calculated as the amplitude of skin deformation and IEMG. The average of VMR for 3 movements was calculated. To compare skin deformation and IEMG between subjects, RA was calculated from VMR at MVF and at each condition. Result is shown. The graph shows the ratio of RA to percent MVF for subject A and E. The horizontal axis shows percent MVF, and the vertical axis shows RA at same percent MVF. The RA of skin deformation was greater than the response to IEMG. The figure shows the summary of the result of all 5 subjects. The results show that the difference between the subject's skin deformation and IEMG was large for 20% to 40%, but was slight for 5% to 20%. The research showed that the RA of skin deformation and IEMG of the subject with 20% to 40% is large. This research suggests that in 20% to 40% RA of skin deformation has a potential to acquire muscle contraction compared to sEMG. In 5% to 20%, the difference of RA between skin deformation and sEMG was right, but RA for skin deformation was greater than RA for IEMG in subject C and E at 5% to 20%. Attached position of the distance sensor unit was set at 20 millimeters from the electrode, but the length and thickness of the arm were not adjusted each condition. Individual difference in trend at low flexion force may have occurred depending on the measurement position. This slide is shown conclusion. Skin deformation and sEMG on the biceps brachii muscle during isometric elbow flexion were measured. The research showed that the RA of skin deformation was larger than that of IEMG in the 20% to 40% MVF. Future work will investigate a difference in skin deformation depending on the measurement position. Thank you for your attention.